Welcome back to West Texas View.
Welcome back to the West Texas View. I'm Johnny Lou Avery, and this is our final segment of our two-show feature on midwifery. And Dawn Cockrell is a certified professional midwife and the founder of the West Texas Birth Services, services people all over the West Texas and New Mexico area. And we've just had a very interesting conversation about birthing at home, the home birth experience. And I want us to spend this one talking about complications.
Sounds good.
What happens when you get from a low risk to a high risk pregnancy, or you're in the midst of a birth and something needs help.
Yes. And what do those things look like? Well, it can be spontaneous bleeding. It can be baby's heart tones are too high or too low. It could be mom is unable to keep water down, or her vitals are starting to rise. So we base our information on the latest evidence-based information. So we watch for those cues, and we take that mother in early, because we don't want to drag things out, wait to see if it'll go away, hopefully. You know, this is
so if you see some signs, you immediately
we
call.
go, yes. Call in for help. I call the hospital, let them know we're coming, give them the paperwork of this mother who had an intended home birth trial and needed some medical support, and that's why we're there. And you know, that's lovingly provided by our area hospitals. Depending on mother where she lives, she'll go to the closest hospital available to her.
And so what percentage? Is this a very low percentage? Or
No, actually, it's going to be between 10-13% of women that are going to need some sort of intercession. Interceding means nudging natural things back into natural processes. So intervention can look like a drug, a surgical intervention, or something like that. So if a midwife's interceding doesn't work, intervention is needed. So a physician will intervene for that mother.
Good. Well, and one other question I had about your partnership with the medical community, whether it's laboratories or whatever, is you are not allowed to prescribe medicine.
No.
And so if a mother needs extra vitamin B12 shots, or needs something for headaches that is more than you can get over the counter, then again you send them to
I refer
either
them to
their
a physician,
own doctor, their own general practitioner.
Yes. And they'll automatically refer to an OB-GYN, because if you're pregnant, their
or certain kinds
malpractice
of medicine.
their malpractice won't cover them caring for a pregnant woman sometimes, so they'll have to move on to an OB-GYN and get care from that person. And if they go back into low risk, they're welcome to come back with the permission of a physician. If that physician feels that this possibly could stay at a moderate to high risk, that person belongs under the care of an OB-GYN. Yeah.
And so one of the things that you're doing now is you got, as we said, clients all over, or patients, whatever you call them, all over West Texas and even into New Mexico.
Yes.
And so you would not accept more than you could handle in that time frame.
That's correct.
And so you may have 5 that you're working with at one time that are spaced out in their delivery process.
Yes. Hopefully at least a week to 2 weeks apart. But we have, we're a small midwifery community, so we support one another. I've trained several midwives that are now currently, one practicing in Seminole, one practicing in San Angelo. I currently have a student who's learning, and she lives in Alpine. So it's one student at a time. They license, they become certified professional midwives. And now the counties that I was serving that don't have any physicians are now having midwives serving those areas. So You know,
and you said your own daughter was very interested in
Yes.
as she's getting ready to
No
graduate
pressure.
from high school. Yeah.
No pressure, but you know, if she did choose to become a midwife, it would be wonderful. I would love it.
Well, but that really is something you have to have a calling for.
I would
don't
think
you
so.
believe?
Yes, and it can turn the most timid of women into those mama bears. Whether you've had children or not, it just takes caring about each woman individually and her specific family and their needs.
Well, walk me through in the last few minutes we've got. How would I go about hiring you if I wanted to hire you, and how would that contract be, or whatever you do?
Sure. We send out an info pack when they call our office. My sweet husband is the one that's usually answering the phone.
And does a wonderful job with the website.
Yes, he does. He's the man behind the woman. And he will answer questions over the phone, help them with financial questions.
Does insurance pay this?
It does.
Okay.
Certain insurance companies refuse to pay certified professional midwives. They want to pay only certified nurse midwives because they want a physician in the room when the baby is born. So we can see some inequality in the insurance industry, but that will change, I think, in the next few years. And we do finance. We don't turn anybody away due to financial reasons. We work with many, many people. But also that first interview where we do the risk assessment, where we do your history, is extremely important. That way we can refer you on to a better, to a person that could meet your needs better if you were high risk. So that's our, our main point. It's at that first visit. And we would love to see mothers when they first find out that they're pregnant, but some of them don't find out till they're well beyond their first trimester.
So do you ever have a mother come to you and say, I think I'm pregnant?
Sure, absolutely. And we can do
The test.
your little test, or you can go off and find one at the dollar store. They're just the same. And they'll come in with 5 tests all saying yes, but they're still unsure. And they just don't believe it till they hear that heartbeat sometimes.
And so then when I come to you and you say, okay, I've determined you're low risk, and this is what we'll do, and this is how many times we'll see you, and this, then you begin their education and their family's education.
That's right.
So you feel like you're best of friends by the time this is over.
Yeah, I think so. And you definitely are going to know if they're not happy, because they'll tell you, and they don't feel any qualms whatsoever, letting you know how they feel. And that to me is a really great compliment, because I want to meet those needs.
That's true. This has been so interesting, and I'm so glad that Dawn Cockrell didn't have to deliver a baby today and was able to come. This is information that I just think we all need to know, whether we're interested in delivering a baby from this vantage point or going to a hospital. Is still information you need to know. Thank you for joining us, and we'll see you next Sunday with another program.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB TV and KWES TV.